So welcome to this episode of NLN Podcast Nursing EDge Unscripted. I'm your host, Dr. Stephen Palazzo, a member of the editorial board of Nursing Education Perspectives. In this episode, we will discuss the effects of simulation on nursing students' ethnocultural empathy. My guest today is Dr. Fabiola Lalande, an associate professor at the Richard and Shella Young School of Nursing at Regis College in Weston, Massachusetts. We will discuss their article, The Effects of Reverse Role Simulation on Nursing Students' Ethnocultural Empathy, a Quantitative Study. This article can be found in the current November-December issue of Nursing Education Perspectives. So I'd like to welcome our guest today, Dr. Lalande. How are you?
I'm good. Well, thank you for having me here today.
You're welcome. We're absolutely pleased to have a discussion with you. Could you briefly start out by describing your study and the scale of ethnocultural empathy that you use to measure your outcome variables?
Sure. To really explain the study, I would have to give you a little bit of a background about
Please.
how that study came. And the idea of studying new ways of teaching cultural competence is something I have been thinking about for a little while. And as an immigrant, you can notice by my accent, I've been always bothered with the discrepancy in health and healthcare services that minorities experience. And as a nurse educator, I really couldn't understand why we can't really fill that gap. And that even though we are putting so much effort into teaching cultural competence in nursing education, we still haven't reached the goal. And what is it that we are missing, right? So as I was really diving more into the subject, I ended up coming across multiple articles saying that when you ask a healthcare provider, what is cultural competence? And they will talk about knowing norms and customs of specific cultural diverse groups. But when you ask that for the patients themselves, they will talk a lot about the attitude of the healthcare provider. So that was really what I was thinking. Maybe that's what's missing. We are not really teaching changes in attitude and empathy for these patients, for the students, because we are focused on teaching them norms and customs of different specific groups. And that's not really helpful. That's not what the patients are looking for. And with that being said, patients have always mentioned empathy, empathetic care. And I was thinking, how can we teach that in nursing school? That's such a hard thing to teach, right? To help students develop. And that's how I thought about coming up with this reverse role simulation, because we know that empathy is also, it's an innate trait, but it's also a skill that can be trained and enhanced with practice. And but to have that happen, you have to either have a strong connection with the person, like a mom watching a baby crying, she will feel that pain, or have experienced that thing yourself, that situation. For example, if you watch somebody getting hit in the nose and you can feel their pain, right? So you need to experience that yourself. Doing the reverse role simulation would put the patient in that, in the experience and the perspective of the patient, and really so they could feel how it feels to be in that situation and see if that would cause any change in their ethnocultural empathy towards patients from different backgrounds. So that was the idea behind this study. The study was really a pilot study where we would measure the students' empathy towards ethnically diverse patients. We measured their empathy levels before and after the simulation. The tool that we use to measure their empathy is called the Scale of Ethnocultural Empathy by Dr. Wang. That tool was designed to specifically measure individuals' ability to empathize with people from different ethnic and cultural backgrounds. More specifically, the scale is divided into 4 subcategories, and it will look into this person's ability to understand, share feelings, respond to feelings and experiences of individuals from diverse backgrounds. The study really showed that their empathy before and after the simulation had increased a lot. And that was very interesting to see.
That's great. So tell us a little bit about the process and how you created the role reversal simulation. And if you could speak to what were some of the difficulties you encountered creating this type of simulation?
Sure. Creating the simulation itself was a challenge because I knew that to really cause a change in empathy, we would have to dive and make a story that the students would really have that
Right.
feel, right? And really feeling the patient's shoes. And for that, I would really have to tap in their affective learning, really get their emotions to be flowing throughout the simulation. So reverse role simulation was a great way to start. In the reverse role simulation, instead of the students who usually come to simulation thinking they're going to be the nurse themselves, they are placed in bed and say, today you are the patient, right? And you are receiving the care. Plotting the scenario was really the challenge because we would like to immerse them, the students, into the patient perspective without really creating any, trying to avoid creating any stigma, cultural stigma, or stereotypes, right? So we needed to invent a scenario where they would feel very unfamiliar with the care being provided to them. And for that, we had to come up with fictional medications, and we used fictional names for the medications. We had fictional medical approaches to treat a broken arm, because in the scenario, the patient, which was the student, right? The student was hiking and the patient fell and woke up in a hospital with the right arm pain. So, and they're receiving care, but the providers don't speak the same language as them. The rooms look different, the treatments are different, and they are trying to communicate that they have an allergy, but the provider fully are not really grasping of what they are trying to say. We are not providing any ways that they can get a translator at that point. And just getting those feelings flourishing and having the students feel like the patients actually feel when they're in that situation. And that was really, I think, the hardest part was to put everything together. But then after that, I think everything flowed pretty well.
It sounds like a wonderful experience though, right? Being in a situation that maybe many of us haven't been in before and like you said, tapping into that empathy and really understanding the perspective of another person who may have a difference in communication, difference in language, difference in culture, and like you said, being transported into a healthcare environment that you're unfamiliar with, right?
Right. And especially knowing that our nursing workforce is pretty homogeneous, if you think of it. We don't have a lot of diverse within nursing.
Right.
And giving that experience to our nursing students might create that needed shared experience between the student and the patient so that when they're providing care, they can feel what the patient would feel like.
Yeah, exactly. And how did the students respond to the simulations?
Now, that is, I think, a very interesting question because, of course, we use a very specific tool to measure the level of empathy before and after. But I do think that the most interesting portion of the study was not documented. It was really what they talked about in debriefing,
Right.
saying like how they were fearful of the care that they were receiving, and not because the nurse was mean or anything, but because they couldn't trust that they knew that they had an allergy or that they knew what the patient needed. And that was very interesting because at that point, honestly, I was wishing I did a qualitative study as well, but it was really a regret of mine of not going for a mixed study instead. But
Well, we don't know sometimes,
yeah,
right? And sometimes it's just you want to just get your study through, and it's easy to do a pre-test, post-test, and if you don't make it too complicated, you can get it through and do the work. And
Right.
it gave you enough information, right? You said it's a pilot study. So it gave you enough information that you're thinking about those things like, oh, I could do this again and ask questions and have more qualitative focus to it. Because, as we know,
Exactly.
debriefing is usually the really richest part of a simulation.
Yeah,
And a lot of stuff comes out during a debrief that can be really rich.
that's true. That's very true. And it was actually very interesting to hear how distrust came as one of the main things. And I didn't see that coming, but then of
Yeah.
course it makes sense.
It does make sense, right? Think about if, I mean, I was trying to think if I go somewhere to a different country that I don't know much about and I'm working and I become injured or ill and people are speaking to me in a language I don't understand. I mean, when you don't understand what someone's saying, right? How do you know that you're getting the care that you think you need? Or that they're
Right.
not missing something. It has nothing to do about
Exactly.
their actual qualifications or expertise. It's just that piece is missing, that communication where I know when I go somewhere here, I can understand everything someone's saying and I can understand what they're going to be doing. And if there's something I can advocate for myself because I understand what's being said and if something's being
Right.
missed, and you just don't know, it'd be
Right.
right. If you could recommend just one strategy to integrate ethnocultural empathy simulation into a nursing program, what would that be? What would be your one piece of advice, one strategy that could help somebody think about doing it next semester or the semester after?
Well, I would say for you to start small but make intentional changes, it needs to be really, you need to tap into the affective learning, use experiential learning is really what going to cause a change in empathy. And I focus on ethnic, ethnocultural empathy, but that can be really used towards any targeted population
Hmm.
that you think of. And just it doesn't need to be something as elaborated. If the school don't have enough money to get a 3D or a VR,
Right.
maybe we could start small, just putting the patient. I have done that in the past of having a patient, a student research a culture that they would play the role of the patient. So that's simulated patient. And then when they come in, they play that role and they need to really use that culture as part of their role. And then come the student, they're going to be the nurse. And then debriefing the true perspective at the end is something that was very interesting too.
What else would you like us to know about your study, about your experience?
Well, I think that this is a field that we still have a lot to learn. So I certainly think that by it can be expanded in so many different ways. So, like starting with the qualitative information that would be beautiful to have. We could use similar simulations towards different targeted populations. That would be also something very, I think, useful in that field. We really don't know, as nursing faculty, we really don't know how to teach empathy, how to
Hmm.
help students enhance their empathy.
Right. Well, I would imagine you'd be receptive to those who might be listening and be interested in this type of work and expanding on the work that you did or partnering with you to explore some of these variables within their own school.
That would be beautiful. That would be very great. It would be nice to really start expanding and getting different group of students, right? Because my
Right.
study was done in the northeastern portion of the country, but it would be nice to get different subjects for the study.
Well, I want to thank you so much for joining us for this really important conversation. I appreciate your time and your expertise in broadening our understanding of this topic and how we can begin to introduce this in our own institutions. And to our listeners, if you've not had an opportunity, please look for the author's work, The Effects of Reverse Role Simulation on Nursing Students' Ethnocultural Empathy, a Quantitative Study in the November-December issue of Nursing Education Perspectives. And I want to thank all of you for listening, and I want to especially thank you, Dr. Lalande, for joining us and sharing just a little piece of your work that you're doing. Very inspirational.
Well, thank you for having me.